Are you turning age 65 and still employed? If so, you have the option of signing up for Medicare or you can stay on your employer's plan. In this short video with a Medicare expert, Lance Otey, we discuss some options you may have. So if you're currently employed and you're turning age 65 this year, what should you do?
Need to get with their Medicare broker to help them weigh their options. So there's many factors that'll go into this decision, such as how much is the cost to the employee to remain on the employer plan? What are your specific healthcare needs? How much longer do you intend to work? The nice thing, though, is that if you do choose to remain on your employer-sponsored plan and then you change your mind later, you can transition to Medicare at that point. Another option, which is very rare, is to keep your employer-sponsored insurance and have Medicare. One example might be if your employer pays all of your costs, so 100% of the employee costs for coverage. If you end up choosing to have both, one of them, of course, will be considered primary and the other secondary, and a coordination of benefits will have to occur.
So if you are want to remain on your employer's plan, you can do that. And then when the time comes for you to fully retire, you can transition to Medicare. So is that automatic? Does it automatically happen once you walk out the door?
And that's going to be kind of specific to your situation. So one way that it could happen is if you immediately file for Social Security. That will actually trigger Parts A and Parts B to become effective. But whenever you terminate your employer-sponsored coverage, whether that's due to leaving the employer or simply just choosing to, that actually creates a special enrollment period for Medicare, and that opens up your enrollment window. And so, that's kind of like what I was saying. If you choose to stick with your employer plan and then later change your mind, it's really not that difficult to get